Now, coming to the clinical features of Ohm's hemorrhagic fever, okay, they here also you will have, the same viral infection that you have, that there'll be no rash. Here, only there'll be hyperemia of the face, there'll be no rash, generalized lymphadenopathy, different lymphadenopathy, and splenomegaly may be there, and patient may present with CNS dysfunction also. In KFD, which is there, very much there in India, okay, KFD is very similar to the clinical features are very similar to the Ohm's hemorrhagic fever. It's just that this disease occurs in two phases. It's called biphasic illness. Okay, the first phase will last for 6 to 11 days and is followed by an afebrile period of 9 to 21 days. Okay, and more than 50% or up to 50% of people will have a relapse, and that relapse the patient will develop meningoencephalitis. So in KFD, you have the first phase where the patient presents with fever. Okay, and the clinical symptoms and signs are similar to the Ohm's hemorrhagic fever, which is mentioned on the above row. But approximately up to 50% of the patients will relapse and develop meningoencephalitis. Okay. Now coming to the diagnosis for viral hemorrhagic fever. Okay, we have serology, we have PCR, that is RT-PCR, we have immunohistochemistry, where we stain the tissues and then look for the virus. Then we can grow all these viruses, though it's very, very dangerous, or we can directly observe the virus using an electron microscope. So this can be a way of writing. Now, because Ebola virus, okay, we'll come back to the diagnosis later. I just want to tell you that most of the time you may get a short note on Ebola virus or Marburg virus, okay, and this Ebola virus has been declared as a public health emergency of international concern in 2014 because of the outbreak. Okay, it has 4 subtypes. Okay, I've already mentioned to you Zaire, Sudan, Western Ivory Coast, and they all differ from each other by if you have to sequence the nucleotide, they will differ from each other like up to 40%. Like we had herpes simplex virus 1 and herpes simplex virus 2. They belong to the same virus, but there was some nucleotide difference in them. Same thing, all these Ebola strains, whether Zaire, Sudan, Western Ivory, they are Ebola viruses, but they differ from each other up to 40% in the nucleotide sequence. Okay. These species are of epidemiological importance. It is advised for treatment-wise or, as far as mortality rate is concerned or morbidity, there is no difference. Okay. And the one which caused the last outbreak in 2014, movies have been made, and maybe if you see the news, you would have seen. Okay, it was in 2014, that was because of the Zaire strain. Okay, so since it's reported, we have had more than 17,000 cases. Only fortunately that the outbreaks were contained, okay, and more than 7,000 deaths. Okay, and the African epidemic which occurred in 2014 lasted till 2016, but we didn't have many cases. Okay, for Ebola, unlike Marburg, okay, Marburg also it's postulated that bats are the ones which are the main reservoir. For Ebola, the main reservoir is mainly the fruit bats or the primates, that is the apes and the monkeys. And transmission has occurred mainly because of close contact with the blood, secretions, organs, or other body fluids of infected animals, such as chimpanzees, gorillas, fruit bats, or monkeys. Human-to-human transmission has been documented, and this happens only when the infection has been introduced from these primates to the humans. Once introduced to humans, Ebola spreads among people via direct contact. And that direct contact is, as a healthcare personnel, you might get infected through the blood, secretions, organs, or other body fluids from the infected person. Okay, and sometimes you may get infection from infected surfaces and materials. Example from the bed, the clothing, the syringes, etc. Okay, now so much, in the present pandemic that we are having, you will see all people walking around with the PPE, protective equipment that they are wearing. And for those of you who see the news daily, how they dispose the cases also, this SARS-CoV-2. They go with full PPE, N95 masks, those were the days of actually that kind of, that kind of gear you would wear for Ebola only. But now SARS-CoV-2 is the mortality rate is very, very less compared to Ebola. But here in India, we are using extra precaution. Okay. In spite of that, the transmission, the infectivity rate for SARS-CoV-2 is very high, but the morbidity and mortality is very less. For Ebola, it's just the other way around. Mortality, morbidity, very high, but the transmission rate is not as effective as SARS-CoV-2. Okay, but anyway, those kind of things we used to see only in movies or when we saw the news, the way they used to wear. Nowadays, even if you come to NEIGHRIMS, now you're at home, if you come to NEIGHRIMS, you'll see everyone walking around with a PPE in the ICU, in the casualty. Okay, you should come back, all of you, and help us. Healthcare workers and close contact family members are greater risk of contracting the infection in spite of using all the protective equipment. In fact, many doctors have died, many nurses have died during their treatment of these patients. Okay, Ebola can even be secreted in the semen after 3 months. Okay, however, sexual transmission has not been documented. Okay, so this is as a repetition. I've already mentioned to you, initially all of them will start with viral infection, which will ultimately present with rash, hemorrhage, DIC, leading to shock and death. Okay, so this will be common to everyone actually. Okay, lab diagnosis for Ebola or many other viral hemorrhagic fever, the mainstay of diagnosis is serology. What I mean by serology is that you detect for the presence of antibodies. So you can use ELISA for detecting either the IgM or IgG. Okay, remember that much. If you cannot use ELISA, you can use immunofluorescence test or antibody Faj indicator assay. So you can remember ELISA. ELISA is a serological test where you can detect the presence of either IgM or IgG or both. Okay. Apart from antibody detection, serology also includes the detection of antigen. Okay. So it can detect this antigen can also be detected using ELISA. Okay. You will not remember all these proteins and all that, but when you write the diagnosis, the laboratory diagnosis, remember that we can collect blood and look for antibodies, either IgM or IgG or both, and also look for the presence of antigen. Okay. All of them are RNA viruses. Okay, so we can use a reverse transcriptase PCR assay, or we can use a real-time PCR assay. Real-time PCR assay we can use for both DNA and RNA viruses, but reverse transcriptase PCR is a must for RNA viruses. Okay, we can observe these viruses directly on the electron microscope. Okay, and most of these viruses can be grown in tissue culture using vero cell line. Okay, only thing is, this is very, very important, is that since they are highly contagious, and sorry, they are highly, the morbidity, mortality is so high, you cannot process these samples openly. We need a biosafety level of 4. Okay, that means where we don't generate any aerosol, where the room should be having a negative pressure, nothing from the room will go out. These precautions should be taken, otherwise the lab personnel will definitely get infected and die. Okay, because there's a great risk of laboratory spread of the virus. Okay, no vaccine till now, so we will not go into that. Marburg virus, which is equally deadly, was first reported in Germany and Yugoslavia. And this also was first reported in laboratory workers who were exposed to tissues of African green monkey, which were brought from Africa. Okay, after that, more than 450 cases, means now more are there, have been reported in various African countries such as Kenya, South Africa, but the number is very less. Okay, the last outbreak was in 2005 in Angola, which affected around 252 people, and they were out of these 227 died. So that means the mortality rate was almost 90%. Okay, so these are very deadly viruses. Fortunately, the spread is not so fast and they are getting contained. For both these Marburg and Ebola, the only treatment is supportive treatment, which you all know, like for most viral infections, is usually supportive treatment. Okay. Ribavirin can be given, but that's not approved as yet. Convalescent phase plasma, you must be reading the news nowadays also, that plasma therapy is being given to SARS-CoV-2 patient. What is this plasma therapy? This is nothing but, suppose a person has suffered from the disease, and we presume that that person is having good antibodies. So we take his blood where the antibody titer is good, and then we transfuse it to the patient who's getting infected. It's like giving ready-made antibodies, ready-made antibodies to a person who's sick. Okay, so plasma therapy is also being practiced even for SARS-CoV-2, the current pandemic that we have, and the same plasma therapy is also being given for these because there is no specific antiviral drug. So we collect the blood, okay, from the patients who have suffered, okay, and then we check the antibody titers. When the antibody titers is above a certain level, we can safely transfuse that blood for a person who's sick due to viral hemorrhagic fever, and we presume that these antibodies will take care and will neutralize the virus. Okay. And the very important part of this is to strictly isolate, okay, like the way we are doing now for SARS-CoV-2. The minute we know that the patient is having Ebola or Marburg or whatever the infection, is viral hemorrhagic fever, we should strictly ensure that he's isolated from other people, because human to human transmission has been documented, and because the mortality and morbidity is so high, and because there's no treatment, okay, so the only way we can stop this infection is that we ensure that the patient is isolated. Okay, because he's a danger not only to the treating staff, but also to the other patients in the hospital. And of course, these are all notifiable diseases which have to be reported. Okay, we cannot quietly just treat some patient in NEIGHRIMS or anywhere, because if there's an outbreak, the government should be aware so that it can be contained. Okay, so these are normal things that there's no need for me to discuss. Avoid contact with host species like rodents, okay, primates, so we don't have much around, okay, and discourage rodents from entering or living in human population, okay. Then insects. Insect repellents means those which are transmitted by mosquito, there's nothing much we can help, but we can at least try to control the mosquito population or sleep with proper clothing and bed nets, okay. These are common for all vector-borne diseases, okay. Amongst these viral hemorrhagic fever, the only vaccine which is available is for yellow fever, okay. And it has been effectively used, okay. Then these things also, you know, for all disposable gowns, glove, mask. That's what I'm telling you. Wherever you are, I don't know which states all of you belong to, but you must be seeing in the respective state where you belong how people are wearing PPE. Even drivers nowadays, drivers which are ferrying these samples also, they come inside NEIGHRIMS with full PPE. So these are the protective gears that you have to wear. Okay. These are some of the pictures. Okay, nowadays you can see them, a lot of people wearing these kind of things also in NEIGHRIMS also itself, or wherever you are, you might be seeing them. Okay, in the hospital, many of the people are wearing this. Okay, one important thing is that, like I said last time, these are very dangerous viruses. Okay, and if these are used as biological weapons, okay, then they will be very, very deadly. For example, Marburg and Ebola, you can imagine the impact if these were used as a biological weapon. We will have a mortality rate which is almost going to be 100%. Okay. However, these are some of the information that we have. Most of these agents are not stable in the dry form. Okay. Most of them, we are not very sure whether they are stable or not in aerosol form. However, among the viral hemorrhagic group of viruses, the arenaviruses have found to be effective in aerosol form, because most of the biological warfare, biological weapons that they have used, they have always aerosolized it. In the history of mankind, if you see, most of the time, if they have used a biological agent, whether it's a virus, a bacteria, they have aerosolized it. So amongst the viral hemorrhagic fever, it's only the arenavirus, okay, which have been aerosolized. Okay, and Rift Valley fever, that it doesn't have a very high mortality anyway. It is a more stable in liquid or frozen state. Okay, so but then nevertheless, we must be aware that these agents can be used as biological weapons. Okay, and it has been documented in history that hemorrhagic viral fevers have been used by Russians and the United States. Okay, and okay, these are documented scientific literature. It's not that, you know, just a newspaper clipping or anything. Yellow fever apparently was used by North Korea also. Okay, now you know anything can happen in North Korea also. Okay, that's all. So please remember that when you get a question for viral hemorrhagic fever, okay, you will get it as a short note on viral hemorrhagic fever as such, or you might get on Marburg, Ebola, because they are the most severe kind of diseases are caused by these viruses. And being in India, practicing in India, you must be aware of KFD, gastrointestinal forest disease, and dengue. Dengue was anyway taught to you. Okay, this is just a combination of all the viruses. Okay, we cannot teach them separately. They're not very important for us also. But you must be aware of Ebola, Marburg, gastrointestinal forest disease, and dengue. But sometimes it comes as a short note. Okay, so please remember that it comes as a short note. So you must remember that when you get viral hemorrhagic fever, just at least try to remember the 4 families that are involved. You may not remember all the names in each family, but at least some of them, and especially the ones which are there in India and the ones which have caused recent outbreaks, okay, like hantavirus, Marburg, Ebola. Okay, thank you.